Hello, my name is Cheyenne and I'm going to be performing NG insertion and removal. So I am going to check my physician's order and gather my supplies. I'm going to identify my patient by two patient identifiers: patient name, date of birth, checking with the armband, and against the procedure card. We're going to wash our hands and explain to the patient the procedure that we're doing, provide them to a comfortable setting and provide privacy, and then we're going to don clean gloves. We're going to assist the patient to a high Fowler's position if not contraindicated, and then we're going to drape some towels or disposable basin, tissues, ice chips and water to the side and stuff like that, but we're going to provide the towel and stuff because they might be coughing or potentially throw up during the process or gag. We're going to check the nose for patency by occluding one nostril and having them breathe through it. We are then going to open our equipment and take out our NG tube. I also have a couple pieces of tape right here to assist me. And we're going to take this and we're going to measure from the tip of the nose to the tip of the earlobe to the tip of the exvoid process. For imaginary purposes, we're going to say about 50. And I'm going to take a piece of tape and mark it at 50. And that way we know this is how far we need to go. All right. Then we're going to lubricate. I don't have any lubrication in my kit, so we're just going to pretend I have a lubrication in here. And we're going to put it in 3 to 4 inches. And then we're going to ask the patient to have their chin downwards and take a deep breath and have them swallow if able. And then we're going to start to insert. If we feel any resistance, choking, gasping, stenosis, inability to speak or hum, we're going to take it out and we're going to try again. But otherwise, we're just going to keep going, keep telling them to swallow. We're going to have them, if they're able to, swallow or chew on some ice chips to keep it from going down the esophagus. And we are going to keep going, have them keep swallowing until we hit this measurement on our tape. And then we're going to take this piece of tape and secure it to their cheek. And then, I didn't touch my face, I caught myself. Then we're going to determine the placement of the tube by using pH balance strips. We would take a tube and aspirate and test it on the pH strip. It needs to be less than 5. Or 5 and below. And then also the golden rule to check for placement is an x-ray. Also, you want to make sure that this is covered whenever you're inserting the NG tube because gastric contents could come out. And then once we have verified placement, we can take this tape off the cheek, and we would use another piece of tape, but just for time purposes, we would split this in half, and you would put this up here and cross over. But we're just going to put it like this for now, just for time purposes, but we're going to act like that was the crossover tape. And once the tube is secure, then we're going to attach to suction feeding pump clamp the tube according to physician's orders and wash our hands. And then we're going to record the procedure. We're going to say what type of tube, which nerve is used, a description of gastric contents, and verification of patient and placement, and patient's tolerance to the procedure. Now, if we were removing the NG tube, we would, and after I was done, I would remove my gloves and perform hand hygiene. if we're coming to remove, we're going to verify the order, ID the patient with 2 patient identifiers, hand hygiene, explain what we're doing, and don clean gloves. We're going to disconnect the tubing from any suction or anything, feedings or anything like that. Once again, we're going to place a towel, tissues and stuff like that across the patient's chest, because once it's removed, secretions come with it and they might want to like blow their nose. We're going to instruct the patient to hold their breath, and we're going to remove this tape. We're going to act like that's removed. There we go. And then we're going to tell the patient to hold their breath, and we're going to slowly but steadily pull it out. Remember, I have gloves on, so we're just going to kind of wrap it up in our hand. It's going to have gastric secretions and all that type of stuff on there. And once it's all the way out, we're going to dispose of it, or maybe wrap it up in our glove and dispose. Like I said, patient's probably going to want to blow their nose, so we're going to provide nostril care, anything else they need, remove our gloves, perform hand hygiene, and put the patient in a comfortable position, and then document the removal.